like to ask him some questions about hypnosis. The first question is, how were you first introduced to hypnosis?
Really, as a child, I had a great uncle who died about the time I was born, but I heard stories about him all my life. He was a man of means who dabbled in hypnosis in Nashville and was apparently very good. They say he did some anesthesia for some of the doctors. This was back around the turn of the century, early 1900s. But he also did spiritual seances and things. And as a child, I heard all these stories about Uncle Ben Allen. And always, whatever you do, don't ever let anybody hypnotize you. You know, he's weaken your mind and all those things and lose control. So I was I had finished med school, and one of the weekend workshops came to New Orleans, and it was Bill Bryan sold workshops back in about 1960, 61. And Harry Aarons, I was curious. You know, I said, I heard about hypnosis. I can go see what this is. And he had Harry Aarons with him, and who was a lay hypnotist, but very skilled, because of course we were learning it back from the lay hypnotist then. After we ran it out of medicine, we had to learn it back. And I went to the thing and very skeptical, and Aarons did a group hypnosis. And of course I was violating what amounted to, I didn't realize I was even going in a trance. I'm going to resist all this. But I was violating what amounted to a post-hypnotic suggestion by being hypnotized, and I had a serious reaction. I got sick and vomited. I had to go to the men's room and vomit, and I said, what the devil is going on here? And then I had a rather remarkable experience in that workshop. Brian, anybody who ever knew Brian, he was sort of the wild man of hypnosis in those days, willing to try anything. And he asked for a volunteer that had a disorder that had been treated with allopathic medicine and didn't respond to it and all that. And I literally hadn't been able to breathe through my nose since age 12. I'd had sinus trouble, and every couple of years it would flare up with pus, and they'd fracture into my maxillary sinus and drain the pus. And I hated all that stuff. And it was really a discomfort to me. And he was looking for somebody with asthma. Nobody would volunteer. And I said, I can't. I said, you are try sinusitis. He said, come on up. And I have a tape of this somewhere. And he regressed me back to age 12 when I had a real original case of sinusitis. It made it a target organ. And the circumstances were very special. It was, I had been a very well-behaved, well-controlled child, never gave anybody any trouble, did what I was supposed to do. And this thing gave me the worst headache. It was so bad And it was midnight on Saturday night, and it's the first time in my life that I'd made no attempt to control my behavior. I just screamed and hollered. I was there in the mother and dad's bedroom. And midnight on Saturday night, they called for Dr. Lejeune to make a house call. And he was chief of ENT at Tulane Med School and the president of the National Society. He had been my father's roommate in college, so, you know, in extremis. And he came. And you know, I'm telling this story, I'm in a regression with the thing, and Brian lays down, he says, "And what did Dr. Lejeune find?" And I said, "Oh, he found I had a terrible sinusitis." He said, "He better find that, hadn't he?" And, you know, I said, "Yeah, I guess." He said, "But you don't have to have a stuffy nose now to prove you're not a bad boy, do you?" And I just opened my eyes. I could just feel my nose open up. And I really hardly had a cold since then. And it was so dramatic. And people ask me, you know, how did they say they think I get results because I'm so sure my patients can do it, can get well. I said, if you get treated yourself and have a dramatic thing and you realize what a powerful control the mind has over the body, you do believe it. And I don't listen to any BS from my patients. I say, look, you can do it, you know. And I guess it fits with a surgical personality anyway. You know, I don't want a lot of long-term stuff. Let's cut out the appendix and get on with life. And so those are my two introductions. That from the childhood prohibition against it to sort of stumbling in defiance into being hypnotized and having the kind of emotional reaction you have when you violate a post-hypnotic suggestion. You really have compulsive carrying out of a post-hypnotic suggestion, fixed idea, and then having a rather dramatic cure.
Can you tell me who some of your mentors were, or the individuals who were influential as you studied hypnosis? Brian, you know, he was kind of the bad boy of hypnosis. I went to several of his seminars, and he would try anything. I was always a little chary of his ethics and stuff, but when I wanted to find out what's the leading edge of something, I could go to one of his seminars and find out. But then ASCH came to New Orleans in 1970, and I looked around and I said, you know, these are clearly the ethical people that have some standards and things. These are the people I wanted to associate with, and that's when I joined ASH, I think in 1970. What are some of the roles that you've played in ASH over the years?
Oh, I was sort of permanent vice president for about 4 years while we were working out a lot of things. I've done a good deal of teaching and then became president, and then which goes on into the ERF presidency, and then I took my boards and became president of the American Board of Medical Hypnosis. My boards was fun. I took them in Boston back in during the big fuel crisis, when the oil was cut off, and
boy, it was cold. I'm a southerner, and they had all the thermostats set down into the 60s, and in those days when we didn't have a multiple choice quiz, they had 8 questions that were essay type questions, and they said, this is, you either know this or you don't. It's an open book exam. You got here, take your booklet, you got 2 hours to answer 8 questions. You can go to your room, you can open your book, you can do anything you want to. You haven't got time to learn it if you don't already know it. And so I took it 2 hours, 8 questions. I had 15 minutes for a question. And I got back in my hotel room, and in the bathroom they had one of those infrared lights with a timer on it. Here's a 15-minute timer. So I took my board sitting on the jaw, and I'd turn the timer on, and I'd have a little heat for 15 minutes, and it would let me know in any event I passed. And that was fun. I want to go back to, you asked who my mentors were, and I think they were really all of the greats, but Dave Cheek, of course, I'm a surgeon, and Dave was a surgeon, and I picked up on his ideomotor signals, and they work for me, and they're easy, and they're sort of logical A, B, C, playing 20 questions with the patient's mind, and I've been able to really succeed with my patients by doing analytical work with ideomotors.
Have there been some changes in hypnosis that you've observed over the years?
Changes? Yes, I think we've progressively gone from elaborate ceremonies of inductions. I think the biggest change has been in the understanding of inductions and all kinds of prolonged eye fixations and things to really very simple and quick, just sort of close your eyes and go into daydream type thinking and let's start solving problems. And I think that's an indirect suggestions that there have been a lot of good experimental work on hypnotizability. And for people who are going to treat by just giving direct suggestions, how hypnotizable a person is absolutely vital. But ideomotor signals are really just body language. Everybody has body language, and you can do diagnostic work and get ideomotor signals from anyone, no matter how hypnotizable they may be, and it's I like that approach better.
Could you share with us your own understanding or definition of hypnosis?
Oh yeah, once Roger Sperry got the Nobel Prize in 1981 for his left brain, right brain stuff, and by that time I was pretty experienced with hypnosis and my own observations. There's no doubt in my mind that regardless of EEGs and all those things, and they don't show a lot of shift, that left brain type processing of information is turned off in hypnosis. These people are not verbal. If they're in a good trance, they will not initiate talk. They'll talk if I ask them to. Speak to me and tell me what's going on or what you're thinking, but they don't initiate it. They're certainly not logical. They go into trance logic. They don't keep time. You can distort time. All these things are left brain phenomena, that the deeper the trance, the less present they are. And at least clinically, thinking like that, I move into autonomic signals, the minimal cues as we call them, and the motor signals, and use speech less and less.
Do you have a favorite story about hypnosis that you could share with us?
I think I have a funny. I was the company physician for the Kaiser plant in New Orleans, and they bring in aluminum oxide ore in the plant, and they have these great big pots, open pots, and they electrically heat the aluminum oxide until it becomes liquefied at about 1700 degrees Fahrenheit, and then they run electric current through it to separate the oxygen. The oxygen goes to a carbon anode and becomes carbon dioxide, and the pure aluminum goes out to the edge of the pot, and they can get pure aluminum out of the ore with that. Well, I had a patient who slipped and fell, and his leg went in to this molten aluminum up to his knee, and the EMTs there got him packed in ice right away and did all this stuff, called me, and I met him at the emergency room, and within a half hour I was able to hypnotize him and get him to perceive it as cool and comfortable. He's hallucinating. But one of the things that's perfectly obvious from burn research is that the skin's pretty thick, and he was holding on when he fell in. He came out fast, but the initial burn rarely stays there long enough to burn all the way through the skin, that there's a secondary reaction from the body to reject the injured tissue that is an inflammatory process, and it's activated by the acute trauma. But if you hallucinate it's cool and comfortable, there's no reason for the body's physiology to reject injured tissue. It doesn't perceive it as being injured. If anybody who's had a sunburn knows that when you leave the sun, you're not in trouble, but the heat injury is over. It's the next 3, 8, 12 hours later when the blisters, the fever, the pain, that's the body's reaction. And if you catch them in the golden first 2 hours and hypnotize them, hallucinate that it's cool and comfortable, it doesn't progress from where it started. And I got good color pictures of this from beginning to end. I said, you don't get a case like this all the time. I got to report this. So I got the medical director of Kaiser to get me on the program for the American Occupational Medical Association and present this case, because I had slides. I wouldn't have dared to try to present that case without the slides. Anyway, I was the last speaker, and I packed up my slides, and I was walking out behind 2 surgeons and overheard one of them say to the other, he said, that son of a bitch almost made me believe that. So we still have some skepticism, but we're beginning now. Seattle, different burn units. I personally believe that we'll see the day when a burn unit is considered understaffed if it doesn't have someone who's competent in hypnosis.
Dabney, thank you for sharing that story, but also thank you for spending the time with me today to talk about hypnosis, and I hope we can get this out for other people to see too.
Okay.